Hi, I'm Michelle, and today I'm going to guide you through pelvic floor muscle training to stop bladder leakage after prostate surgery. Now, some of this training information is based on a recent research article, and it's linked in the description below if you'd like to access it. Now, the authors really emphasise the importance of individualised treatment, so please consult with a pelvic floor physiotherapist for your post-op management if you're able to. Now, today we're going to cover when and where to start your pelvic floor exercises, also how to do your pelvic floor exercises when you're starting out after surgery, 2 ways to test your exercises, and also how many exercises you need to do to get good results. Now, you can usually start your pelvic floor training with your surgeon's approval, and this is after your catheter's been removed. It's also very beneficial for bladder control if you can start this pelvic floor training before your surgery. Now, you can start your exercises in any one of the following positions: lying down with your feet flat and your knees bent, over a couple of pillows if you can, or semi-reclined, perhaps in a reclined lounge, or standing upright, particularly if you're familiar with standing pelvic floor exercises and pelvic floor training. Now, if you're currently troubled by leakage, then I really recommend doing your exercises reclined for the first 2 or 3 weeks. Now, let's go through how to do your pelvic floor exercises for bladder control. If we review your pelvic floor muscles, you'll be exercising these muscles during your pelvic training. Your pelvic floor muscles are in and around the area where you sit, as you can see here. Some of the muscles we're focusing on for your bladder control sit at the base of your penis, and they wrap around the base of the penis, along with a muscle that sits deeper inside around your urine tube. Here's how to exercise these muscles to stop bladder leakage. There's 2 parts to doing this exercise correctly. We're going to do each part separately, and then we're going to put them both together. Now, the first part of your exercise involves shortening your penis or drawing it inwards, similar to the way a turtle would pull its head back into its shell. Start by relaxing your breathing. Relax your buttocks and your belly. Now breathe in, and as you breathe out, gently shorten your penis by drawing it inwards towards your body. And now relax. Let's repeat the same exercise again, keeping it gentle, and see if you can do this for 2 to 3 seconds if you're able to. If you're having trouble, try to imagine the action of peeing upwards on the wall. All right, start now, breathe in, and now as you breathe out, shorten your penis for 1 and 2, and now relax. How did you go using this technique? Please try not to worry if this seems challenging at first, because this exercise can really take some time to learn. Now, here's the second part of this exercise. This time I want you to try to contract as if you're gently stopping the flow of urine or just slowing it down a little. Start with your relaxed breathing, relaxing your thighs, your buttocks and your belly. Here we go, breathe in, and as you breathe out, gently contract your muscles as if you're trying to stop the flow. Try to keep contracting for another second or 2, breathing throughout if you can, and now take a rest. All right, we've done the 2 parts. Now let's put parts 1 and 2 together, and this is the correct action for your pelvic floor training. Now don't forget, at the start this needs to be really gentle. Just focus on really good quality and good form rather than contracting strongly. That can come later on. All right, let's start now. Breathe in, and as you breathe out, just gently stop the flow of urine and shorten the penis. Try to keep breathing and hold your muscles contracted for 1 and 2, and now relax right back to resting. Now this is the correct exercise for you to practice, shortening the penis and stopping the flow at the same time. So remember, the key points are to try to breathe normally and to keep your upper belly relaxed throughout the exercises. Now, there's a couple of good ways to know and to test whether you're doing these exercises correctly, because sometimes it's just hard to know. You can test by trying to stop or slow the flow of urine, but you do this just once a week and as a test, not an exercise, just to see if you're using the correct muscles. The other way to test is to stand side onto a mirror. When you use the correct technique, If you're standing side on, you can see your penis move slightly inwards towards your body. Now, how many exercises to start with? This is a big question. I want you to try to start out with 2 to 3 second holds, so they're only a couple of seconds. Repeat these exercises just gently, doing the number of exercises you can manage, up to say 5 or even 10 times in a row if you can do that many. Try and do this routine 2 to 3 times a day. To progress these exercises over the next 2 to 3 weeks, try to hold your exercises for up to 10 seconds and repeat them up to 10 times in a row if you can. But remember, just do what you can manage using really good technique. Remember that it can take a number of weeks to improve your bladder control through exercise. The key is regular practice and progressing your training as your strength improves. I hope this information is helpful for your recovery. I'd really appreciate it if you can give this video the thumbs up if this video helps you. So if you'd like to see more pelvic floor training for bladder control, or if you have any questions, please let me know in the comments below. Thanks so much for watching today. I'll see you next time.